Hello, my name is Dr. Glenn Feltz, and along with Dr. Kent Eichenauer, we co-created the Psychosocial Risk Factor Survey, the PRFS. The PRFS is an assessment tool that helps medical professionals assess for psychological problems that might be affecting a patient's medical health. Those factors that are assessed through the PRFS are depression, anxiety, anger and hostility, social isolation, and emotional guardedness. This video is part of a series of videos on the PRFS, and the next video that you're going to see is Dr. Eichenauer demonstrating how a staff member might give interpretive results to a patient based on their score on the depression scale.
And as you can see, your depression score on here is in the moderate range. Now, basically when we talk about depression, some of the characteristics that go along with this, we might talk about concerns that people might have with certainly their mood. There may be a fair amount of sadness that people have. Sometimes there can be tearfulness, that people find themselves kind of crying for reasons that they're not really sure of. May find ourselves feeling guilty or worthless. May feel like we're responsible for things that we really didn't have any control over. Certainly we can talk about also some typical things that happen with people with depression are there's some kind of change in their appetite and their sleep patterns. They might find themselves kind of feeling very hungry and just kind of eating all the time, or they may find themselves just kind of not feeling hungry at all, and just kind of a small morsel of food fills them up. And it's not uncommon for people to gain or lose a significant amount of body weight during an episode of depression. May find the same kind of thing with our sleep. May find ourselves just kind of sleeping all night long, lots of times during the day, taking naps. We may also find ourselves just kind of dog tired at night, but when our head hits the pillow, ding, suddenly we're awake and our mind's just kind of rolling through the night and we're watching the alarm clock throughout the night. May find ourselves just feeling very tired and fatigued. At the same time, it can go the opposite way, either just kind of feeling very keyed up and restless, and just kind of all this abundance of energy that is just kind of very undirected. And then finally, everything just seems very flat, very monotone, without any kind of ups or downs, and everything just kind of feels very blah. So basically, your score's in the moderate range, and when we talk about the moderate range, it's not as high as what some people's can be, but this would suggest that that this is probably an area that would make some sense to attend to. So let me ask you, when we talk about depression, and this is something that this test does suggest, what do you think? Is this something that you think applies to you then, based on what these test results suggest?